Hi, class. My name is Lawrence Oljol, and I'm going to be sharing about my internship experience this last semester. So I'm just going to go over the couple of the questions for the internship placement. So at the beginning, describe the recruiting, selection, orientation, onboarding, as many as applicable. So, like many of you, I did the survey that we sent into the professor. And now this is my first internship experience in healthcare administration. So I was pretty open to where I would be placed and what I would be doing. I didn't have anything specific or any requirements or anything I wanted to really do. I just wanted to get my foot in the door and just gain some critical experience in any field. And so after we did the surveys, the professor connected me with Dean Nakanishi. He's the administrative director at ADAP, which is the Asian American Drug Addiction Program that serves the communities in LA. They're a nonprofit organization, so I thought that was very interesting. It was my first time really working with a nonprofit organization. And so he gave me the option to do direct services or administration. And I kind of let him decide because it's my first experience, so I didn't know what really I wanted to focus on. But I'm glad I went with that choice because I got a lot of one-on-one time with him. Most of our meetings were just himself and I going over certain topics, which I'll get to later on in the presentation. And then with orientation and onboarding, I like I said, I was only doing it one on one with Dean, so I wasn't really working with any peers or any other managers or directors. I did do the onboarding with some other of the interns there. I was the only healthcare administration intern. Everybody else was really in social work because it's a nonprofit. Um, so I felt a little out of place. I didn't know some of the other department managers or some other the heads of the department, so I was a little confused. The only people I knew that were running the onboarding session were the IT guys because obviously they set it all up. They didn't have a specific date for my group because it was just me for the administration internship. So I would say the onboarding was kind of weird, but it was seamless. All it was just signing paperwork, turning it into their IT team, and that was it. And sorry, I failed to mention that this is a virtual internship, so everything was done online. I guess that process was kind of new for them as well, because most of their interns would come in. So it was just a learning process as we are going through this new new way of interning. So the middle of my internship, describe the type of work activities you engaged in, talk about a project that you were a part of, and what skills did you learn or polish. So my internship really was broken in half, I'd say. The first half of my internship was me and Dean working one-on-one on a biweekly basis. We'd spend an hour together. Half of the hour, he'd go over different topics that he felt were essential for me to learn about a nonprofit. Um, Topics such as like fiscal overview, fundraising, contract compliance, and accreditation. With that, the second half of my interview would be based more towards my project, which I was working on for the 2 months I was working closely with them, which was creating patient surveys. And he wanted to create patient surveys to help maintain their CARF accreditation, ensuring that their organization is meeting the goals of and needs of their patients and customers, and just looking for ways to improve overall. I think they do a lot of great things there, and they were just looking to for ways to enhance and like I said, improve on some of their procedures. So with my project, it was based on patient surveys. So he wanted me to create patient surveys that he would give out to various group sessions that the organization would have with different patients. And so these group sessions, there was like six in total, groups of 20 to 30 patients at a time. And it was just he laid a basic outline of what he wanted, which was questions on a scoreable measure from 1 to 5, like something very simple, very basic, but also allowing patients to comment and voice their concerns or areas of improvement. So it was pretty easy. I let him know my background. I'm a retail manager for a large retail door, and so understanding consumer feedback and looking for ways to improve through that was nothing I wasn't new was something I'm accustomed to. So I felt like my skills transferred very easily, but I did find it difficult. Um, One, being healthcare, it's a lot different, and since everything was virtual and everything's online, I wasn't able to be in the group sessions and really understand the functions and the different connections that are made between the patients and the faculty. And so it was kind of hard to understand what we would need to improve on or what to ask, really. And so there was a lot of back and forth between Dean and I, and even Patty, who's the director of patient services. They critiqued my survey a lot, and it was kind of weird at first. I felt like they were just stepping all over the survey, but Dean reassured me that I laid the foundation for it. Because this is something that they've never done. They haven't really done any patient surveys. So he let me know it was a step in the right direction. And we finally came to agreement on what a basic survey looked like. And again, that just followed or covered topics like how was the group session, how's the faculty in the group session, how's the experience overall, and then what would you like to see more. So real basic, simple, straightforward. Um, so that was the first half of my internship. The second half of my internship, Dean was able to connect me with the Department of Mental Health Care's outreach and engagement team for ADAP. They were given a specific amount of money to fundraise or to spend on outreach and engagement for COVID awareness. And so I've been spending the last 2 months on that. I'm currently in that position right now. He did kind of get me a job. It is paid. So I think it was a great way to just push myself further in my career and gain this experience. Um, right now, it's just pretty much reaching out to different communities in LA and Long Beach, surrounding areas. And it's not just Asian American communities, it's the Latino community, it's the African American community, all communities that are affected and just under resourced to combat COVID. So helping raise awareness in those communities, as well as providing them with not just COVID resources, but like food resources, shelter resources, and job resources. So it's been a really great experience. I'd say I'm more passionate about this second half of my internship than I was the first half, just because I'm doing more groundwork and just more. Not that the patient surveys didn't have its own purpose, and not that it didn't serve ADAP well, but I just feel like the work I'm doing now is just I'm just being gratified in the moment now because I get to interact with these people. I get to offer them support and just offer them help. And I think this is what I was looking for going into the internship. Like I said in the beginning of my presentation, I wasn't sure of what I wanted, but uh, looking at it now, being able to just provide support to others and help others, I think that's why we're all in healthcare. Really, is just wanting to help others and figure out ways to do that through our different avenues. And yeah, so it's been great so far. The end, how did you contribute to the organization? And then what are your takeaways, lessons learned? Um, so throughout my time with ADAP, I really only spoke with Dean, and Dean has connected me through everybody that I've been working with. But Dean's obviously the administrative director, so he's pretty high up and has connections to everybody. But I wish I took that step forward first. I think my networking skills, I'm pretty quiet, or I didn't see the need to reach out, which I feel like is definitely a miss on my part because there's a lot of connections I could have made and just got my name out within ADAP. And from there, all the connections I could have made from them would have been tremendous going forward for my career growth. Um, but overall, I think I still enjoyed it a lot. I still don't regret what I did. I just want to build on it now. And I hope to continue that through the DMH Cares program, the outreach and engagement of COVID awareness. And I hope to just meet more people and just network myself a little bit more. But I think all of this goes well on my resume, and I love the experience. And I don't think it's been a waste of time. I think a lot of people going into the internship course feel like they're wasting their time or doing like they're stuck in and placed in different organizations where they're doing busy work or just meaningless work. And so I haven't felt that way at all. So for the future, what next for you in terms of your career development? What skills do you want to develop? How do you plan to follow through? And what are your specific next steps? How can you support yourself continuing to develop and grow in the field of your dreams? Um, like I said, this was my first experience in healthcare, doing something in the healthcare administrative field. And so with the DMH program, it really opened my eyes to where I can take myself after I graduate. Although it's people I'm working with mainly have like social work degrees or like have studies in social work. Like I feel like healthcare administration for sure translates well. And it's outreach and engagement is something I really want to look into just because I find more purpose in it than I have in any other, or than I have heard in any other internship experience. It's something I really enjoy off the bat, and so I'm still trying to stay connected with Dean and figure out like once this DMH Care Outreach and Engagement project ends, which is at the end of December. I'm hoping to continue with any other projects that ADAP might have or any other projects Dean might have in mind. I enjoy outreach. I think since we're going with into like COVID with the rise of cases, just everything changing. I think it's an interesting place to be, and how doing everything online and virtually is really affecting the way we process and do different things. And so I think it's interesting to be a part of this culture change. And so yeah, that's where I want to take it. That's where I want to see myself in the next 6 months after after we're done with this semester and after we graduate, and just continue building myself in that area of social work and outreach and education and doing those kind of things. But yeah, that's my internship experience so far. I still have 3 more months left with ADAP, doing the outreach and engagement of COVID awareness. So I hope to finish off strong, build more connections, and continue that on once we're done with the semester. And that's the end of my presentation.